Hello and welcome to the Robertson Construction Employee Benefits webinar. The benefits detailed here are in effect for the 2018 and 2019 plan year. My name is Wes Campbell. I'm the Vice President of Structured Employee Benefits of Ohio, and we are the benefits administrator for these plans through Robertson Construction. This packet will outline the health insurance benefits, the dental benefits, vision benefits, life and disability benefits. For questions, please refer to Robin Lufer in your HR department or AJ Santos at our office, whose contact information is in the packet. This cover page outlines some of the important things to note when it comes to your initial enrollment in the benefits. You have 30 days to enroll in coverage after your eligibility date. Your eligibility date is the 61st day after your date of full-time employment. If you do not enroll during that initial enrollment period, you will be required to wait until the next open enrollment period unless you experience a qualifying event as described in the bullet points. Qualifying events offer you the opportunity to change your benefits throughout the course of the year. Examples of qualifying events are marriage, birth of a child, placement for adoption, a court order, or your spouse may lose their coverage where they work, or there might be a divorce or legal separation. There are two health insurance plans offered through Robertson Construction. Both plans also have a reimbursement component to them, which will be outlined later. There is a health savings account qualified plan on the left and a traditional PPO plan on the right. The HSA plan has a $5,000 deductible per person, not to exceed $10,000 per family. After that deductible has been met, Anthem Blue Cross Blue Shield will cover claims at 80%. The member is responsible for 20% until the member reaches the out-of-pocket limit in the gray box of $6,650 per person each calendar year, or $13,300 per family each calendar year. As you will see on a health savings account qualified plan, all expenditures go towards that deductible. There are no office visit copays, there are no prescription drug copays. Everything goes towards the deductible. The advantage is an employee may set up a bank account known as a health savings account. This account will have $500 annually deposited into it by Robertson Construction, and those payments will be distributed quarterly. The money that goes into the health savings account can be used by the insurer to pay for any qualified medical expense on the plan. We'll describe those qualified medical expenses a little bit later. The traditional plan, the PPO, has a $6,000 deductible per person, $12,000 per family. Claims are covered at 100% after that, with an out-of-pocket limit of $7,350 per person, $14,700 per family. This plan does have copays: $30 for a primary care physician visit, $60 for a specialist, $75 for an urgent care visit, and $400 for an emergency room visit. This plan also has prescription drug copays. Copays vary by what type of pharmacy is being used. If you use a level 1 pharmacy, generics are covered for $15, formulary drugs for $45, and non-generic, non-formulary drugs are $85. If you go to a level 2 pharmacy, they are covered for $25, $55, and $95. Level 1 pharmacies encompass most chains, including CVS, Walgreens, Giant Eagle, Kroger, so on and so forth. If you use the mail order program through Anthem, the cost is $30 for a 90-day supply of generics, $135 for a 90-day supply of formulary drugs, and $255 for a 90-day supply of non-generic, non-formulary drugs. As mentioned, both plans have a reimbursement component to it. On the HSA plan, which has a $5,000 individual deductible, the employee is only responsible for the first $4,000. Robertson Construction reimburses everything above $4,000 to the out-of-pocket limit of $6,650. Eligible reimbursements must be sent to AJ Santos in our office, at which point they are approved, sent back to the Robertson HR and you will be reimbursed. Please refer to this sheet for more information. The PPO plan also has a reimbursement program. The reimbursement starts after the employee has spent $2,000 per person on the plan, and the reimbursement program covers all expenditures for deductible related claims above $2,000, all the way to the out-of-pocket limit of $7,350. As mentioned, the HSA qualified plan has the advantage of being attached to a health savings account. The employer again makes a contribution of $125 a quarter to that account. The limit for contributions by the employee to that account is $3,450 per year, $6,900 per family, unless you're over the age of 55, at which point there's a $1,000 catch-up contribution that's allowed. Keep in mind those numbers will be reduced by the $500 that Robertson contributes. Eligible expenses include anything that happens on an employee's health insurance, as well as many other things, including acupuncture, over-the-counter medications, any out-of-pocket on an insured's vision or dental insurance. You can see more examples of eligible expenses listed here. These pages outline the benefits in greater detail, starting with the HSA plan with the $5,000 deductible, then 20% to $6,650. As you will see, most things are going to show 20% because the employee is responsible for the deductible first. Things are covered at 20% after that. These pages outline the benefits on the PPO plan, including things like deductible, out-of-pocket, co-pays, as well as inpatient, outpatient services. Outpatient therapy services such as occupational therapy, physical therapy, and chiropractic, and then the drug copays as well. Keep in mind both plans cover preventative services 100% as required under the Affordable Care Act. Again, mentioning that there is a tiering for pharmacies. However, most pharmacies are in the Level 1 pharmacy program, again, including all major chains. Anthem offers a free teledoc service. For those on the PPO plan, there is a fee for those on the HSA plan, typically $49, and it is through the program called Live Health Online. You may access Live Health Online through the livehealthonline.com website, through their mobile app, or through the My Anthem website. Anthem offers the ability to earn points by completing certain wellness tasks, things like completing a well-being assessment, setting up a well-being plan, entering in a journal, tracking body weight, or tracking exercise. These points can lead to the opportunity to be redeemed for certain prizes. Again, more information can be found on your My Anthem website or through the myhealthylifestyles.com website. More information can be found here about wellness tools offered through Anthem. It's important to note that there is a large difference in cost when deciding where to get your care, be it an emergency room, a minute clinic, a doctor's office, or using the Live Health Online. It's important that you choose an option that is best suits your needs based on the severity of your illness or injury, but you do also want to be conscientious of the cost both to yourself and to the health insurance plan. This chart is helpful when determining what type of delivery service might be best given the condition you're dealing with. For example, you wouldn't want to go to an emergency room for a cold. However, you also wouldn't want to use Live Health Online for a broken arm. That concludes the health insurance portion of this program. The rest of the benefits offered are through Guardian Insurance and begin with the dental insurance. The dental insurance covers preventative services at 100% in or out of network, basic services at 90%, and major services at 60%. Orthodontia is covered at 50%. There is a $50 annual deductible which is waived for preventative services. The annual maximum is $1,000 per calendar year per insured, and Guardian allows you to roll over unused funds from year to year. The orthodontia benefit is $1,000. The dependent age limit has been changed to 26 regardless of education status to be consistent with the health insurance. This chart talks about what services fall under what category. Preventative services typically are cleanings and x-rays along with the oral exam. Basic care is your anesthesia, your fillings, periodontal work, simple and surgical extractions. And then major care covers bridges, dentures, inlays, onlays, and crowns. For information on whether your dentist is in or out of the network, please visit the GuardianAnytime.com website. This page indicates the dental maximum rollover program. You don't have to do anything to participate in this program, but you do have to go and file at least one claim throughout the year. The vision benefits are also offered through Guardian. However, they access the VSP network, which is one of the largest vision networks available. The eye exam copay is $10. The materials copay for new glasses is $25, and that $25 is waived when purchasing contacts. The eye exam is covered for the $10. The $25 covers single vision lenses, line bifocals, and line trifocals, as well as lenticular lenses. The frame allowance is $130, and anything above that is discounted by 20%. The contact allowance is $130, and again, they waive the $25 materials copay. Cosmetic extras such as unlined bifocals, unlined trifocals, auto tint, anti-scratch, anti-reflective usually see a discount of 20 to 25%. You are eligible for the eye exam every year, the lenses every year, and the frames every other year. Those are 12 months from the last date of service, not 12 months from January to December. Again, the dependent age limit has been matched to be 26, consistent with the medical and dental. Again, for information on finding a VSP provider, visit the GuardianAnytime.com website. Next up is life insurance, offered again through Guardian. Robertson Construction provides $15,000 of basic term life insurance to all full-time employees, as well as $15,000 of accidental death and dismemberment. Those are guaranteed issue, and those are provided at no cost to you. You are eligible to buy more life insurance should you need to. You are eligible to purchase anywhere from $10,000 to $300,000. Your spouse is eligible to purchase anywhere from $5,000 to $100,000. And dependent children are eligible to purchase anywhere from $1,000 to $10,000. Guardian will guarantee issue up to $100,000 for the employee, $10,000 for the spouse, and $10,000 for the dependent. Anything above that will require an evidence of insurability form. The rates for this program are right here in the packet and are based on a weekly paycheck deduction. For example, a 40-year-old wishing to have $100,000 of life insurance would pay $5.08 per paycheck. Keep in mind, whatever age you are, that's what age your spouse will be looked at as in the policy. The child rate is based on the dollar amount selected of coverage and is independent of how many children are covered. So for example, $5,000 of coverage costs 23 cents per paycheck, whether you have one child, two children, or three children or more. The life insurance comes with a free will prep service. This includes the ability to create a will, as well as set up things like advanced healthcare directives, executors of estates, financial and healthcare powers of attorney, guardianship, and conservatorship. For more information, please visit the website listed and use the username WillPrep along with the password GLIC09, or use the number listed here. There's a disability insurance program available as well. Short-term disability provides benefits first. There is a core benefit that is available, which is a weekly amount of $250 in benefit. Those benefits begin on the first day for an accident, or after 7 days for an illness, and those benefits last for 26 weeks. That is guaranteed issue. Additionally, you can buy up to 60% of your weekly salary, up to $1,000 per week. It has the same 0-day policy for accident, 7-day for illness, and also lasts 26 weeks. There is also a long-term disability program where you may choose a monthly benefit between $500 and $10,000 per month. Those benefits kick in after 181 days of being off of work, so they dovetail with the short-term disability. And those benefits last until you've reached Social Security normal retirement age. Long-term disability weekly plan illustration can be found here. Your coverages through Guardian include Work-Life Matters, which is what we would call an employee assistance program. It offers you 24/7 consultation over the phone on a wide variety of topics and up to 3 sessions free of charge with a local counselor. The topics range from education to lifestyle and fitness management, dependent care and caregiving, working smarter, and legal and financial. Again, there's a website with a username and password as well as a phone number listed here. Your Guardian coverage also comes with a critical illness benefit. This is a benefit that pays a flat dollar amount should you be diagnosed with one of a number of conditions. It's a lump sum payment that comes to you if you are diagnosed with a cancer, heart attack, stroke, major organ transplant, kidney failure, or a coronary artery bypass graft. These pages outline the privacy notices from Guardian. This is the enrollment application for health insurance through Anthem. Please complete all the sections except for those that are crossed out. This is the application for the Guardian ancillary coverages, the dental, vision, life, and disability insurance. Again, please fill out the sections that apply to the coverages you wish to participate in. Again, for any questions, please refer to Robin Looper in your HR department. Your contact at Structured Employee Benefits, again, is AJ Santos. She can be reached at 1-800-589-7326, extension 15.